Hi, everyone. My name is Yuma Ishii. Thank you for this opportunity to speak with you today. I'm very sorry I cannot be there in person. To share a quick introduction of myself, I pursued an MD PhD at the Tokyo Medical and Dental University in Japan. While there, I also studied abroad at a joint MIT and Harvard lab to learn the applications of AI to clinical medicine. I then worked in the private sector at a leading health tech startup and the public sector at the COVID-19 task force headquarters throughout the pandemic to use and implement data-driven solutions for infectious disease surveillance and control. As an inaugural Quad Fellow, I'm currently applying health informatics techniques to real-world solution. I'm also a co-founder of a global health innovation lab called LIAISON that I will be focusing most of my talk on today. So LIAISON is a nonprofit that was established in 2018. Our aim is to realize a world where all have basic human rights and all can make a living doing what they love. To achieve this, we work to facilitate international partnerships, leverage resources, innovate, advocate, and draft policies to ensure universal healthcare access. In other words, we work with partners and communities on the ground to improve equitable access to health from Japan. At the bottom of the slide, you will see some of the partners we currently work with. So I'd like to introduce a few projects today that may be relevant to our audience. Firstly, we're aiming to launch a paper health record digitization project in Micronesia, an island called Kosrae, and Mexico. As many of you may know, many health institutions and clinics around the world still use paper-based health records to this day. This poses a risk for information loss due to various disasters, as well as delays or errors in patient care due to lack of details and patient background. By digitizing current documents, we aim to start developing local databases that can be securely shared among care providers, even in natural disaster scenarios. We are also currently collaborating with the Institut Pasteur and the Embassy of France in Japan to establish the Institut Pasteur du Japon and increase partnerships between Japanese and global researchers in the intersection of medicine, environment, and climate change. Current partners to the Institut Pasteur project in Japan include drone companies such as Soratech in the bottom right image here that conduct surveillance for diseases, as well as global laboratories, for global laboratories within the Pasteur network that work closely with local governments. We believe that this may be a great opportunity and partner for the EO4Health project, and I will speak more about our suggestions for collaborations in the later slides. We also advocate for polio eradication and global health in general with the Bill and Melinda Gates Foundation and the Global Polio Eradication Initiative to achieve a polio-free world in the next few years. Polio advocacy not only requires immunization efforts, but surveillance also is essential for the prevention and monitoring of the progress that we see in the eradication efforts. We believe there are many ways that satellite imaging and other technologies can contribute greatly to this, and look forward to discussing collaborative opportunities on this note as well. Finally, we work across health tech innovation by identifying low-cost, high-impact health AI solutions with the American Chamber of Commerce in Japan. There have been many innovative startups that we have discovered over the past 2 years, and we're excited to see how they can also play a role in this current ecosystem. So here are some of the locations we work across. Despite the regional differences, we notice that there are shared challenges across the countries we work with. Firstly, there's a notable shortage of specialized clinicians, especially in rural areas. This causes issues in the speedy delivery of care and prevention of certain diseases. Next, we notice that there's a challenge when it comes to the swift and secure delivery of customized care due to limitations in patient information and data sharing. Finally, we find that there's a great need to increase data-based holistic evidence generation regarding health burdens. So this is currently the area we're focused on tackling. So due to this, we've been very excited for the possibilities that lie ahead with this EO4Health project. First, for Japan, combating health crisis management after the occurrence of natural disasters, such as with the recent earthquake on New Year's Day in Ishikawa Prefecture, is critical. Early intervention through crisis predictions and damage estimations, as well as expanding capabilities to map out safe evacuation and transportation plans for patients would not only aid our nation, but contribute to any country that faces similar disasters. This is also valuable for countries like Japan, where we face the challenge of an aging population. Secondly, we're excited to see the possibilities of how we could combine EO4Health satellite capabilities with our drone network. Currently, we have a partner that is working across improved access to vaccines and healthcare products in rural and difficult to reach areas through drone delivery. Through a combined approach with EO4Health and the partners here, we're interested in investigating how we could potentially increase methods for delivery of critical healthcare products across the world. Furthermore, leveraging satellite imaging to combat infectious disease is also a large area of interest for our team. Exploring potential breeding areas for mosquitoes and other vectors could aid in the prevention of vector-borne infectious diseases. We're also interested in the combination of satellite imaging with sewage water data in the prevention and eradication of wash-related diseases such as polio. As such, these are the three main areas that we propose collaborative projects with EO4Health, as well as all partners present today. We'd greatly appreciate to receive any feedback on our suggestions, as well as continue exploring potential next steps throughout the next few months in the lead up to the next workshop. This may be of interest. I can be found at the following contacts. Please feel free to contact with me online, and I'd be delighted to discuss further over a meeting. Thank you again for the opportunity to speak with you today, and I look forward to hearing the other presentations. Thank you.